Welcome to the Daily Dish. I'm Shea Pasa. Today in She Knows Healthy You, your heart. Heart disease is the #1 killer of women, yet it seems to be one of the last things we talk about. Joining me today is former Surgeon General Richard Camarna and one of our favorite actresses, Andie MacDowell. Andie, Dr. Camarna, thanks so much for being with us today.
Thank you.
Andie, let's start with you. Heart disease is the #1 killer of women. Tell us how getting women to talk about this has a special place in your heart.
Yeah, my mother died at the very young age of 53 from a heart attack, and as I'm getting closer to her age, I started to have a lot of anxiety that perhaps, that I could have the same fate that she had. And by using Time to Talk Cardio website, it's a great educational program. I have gotten the skills that it takes to go into my healthcare provider and feel like I'm getting all the answers that I need to know that I'm in great health. And it's really helped me decrease my anxiety about that.
Dr. Camarna, women are dying every day from heart disease, and yet it's one of the last things we talk about. Why do you think we have such a hesitation when it comes to this?
Well, I think there's a lot of reasons for it. Andie's pointed out some of them. I think is that for many, many years it was assumed that this was a man's disease and that women really didn't suffer from cardiovascular disease like men do. And in fact, we know they do, and they have different signs and symptoms. So there's a big difference between men and women. But the common approach for both men and women is to access this website at timetotalkcardio.com and learn how to become a more effective communicator, because for both men and women, we see that there are problems in communication. They often are intimidated. They forget what they want to ask the doctor. The doctor's in a hurry, doesn't have enough time. And so when you look at that, you have two people leaving the encounter frustrated, each not getting the information across that they wanted. Time to Talk Cardio benefits both of them.
So how did this program come about?
Well, the program began because we ran into lots of people like Andie who were really not satisfied with the encounters, were suffering because of not having good communication and suffering a burden of disease that was preventable with cardiovascular disease, or not knowing how to take their medications or how to care for their heart disease. So we decided in the partnership, which is Merck, which is Canyon Ranch Institute, the American Academy of Family Physicians, the Rios Works, all came together and said, let's work together and put this program together to improve communications for all patients around cardiovascular health. So anybody in the United States can access this website, learn how to be a better communicator, and it starts the moment you're on the website. And that results in better health for you.
So Andie, tell me about your personal experience with this website. When you went online, what was the first thing that really helped you through this process?
They give you there's a test that you can take, so it's very specific to each person's needs. And then there's these videos. There's over 500 videos, half of which are for the patient, half for the doctor. And the videos that popped up for me and that I watched, they're very short. Each one was specifically targeting the issues that I have because of the test that I had taken. And two of the things that I can tell you right off that have transformed my experience with my doctor is preparation, having the questions written down. I write, being sure you write down everything. I had a list of what I want to talk about so that I don't forget something and I'm prepared, or I don't get intimidated and forget something. And also repeating what the doctor has told me at the end. I go over, okay, I want to be sure that I understand, and then I repeat. And those two things have really changed my relationship with my practitioner. It's really helped me a lot.
Excellent. Now, one last question, doctor. A lot of women think this is something that they'll have to deal with down the road, especially if they do not have a family history. At what age should women really be concerned about her heart health?
Well, I think we should be concerned about heart health throughout your age. I mean, from young to old. As a young lady, what we start seeing trends in women become less physically active. If you're not careful with what you're eating, even if you have a healthy history, a lot of the things you do, the behaviors you choose to engage in, add risk to your cardiovascular profile, which can cause you to have heart problems later in life. So understanding at an early age about physical activity, about the right diet, about the right portion size, and so on, how to reduce stress in your life, all will have a cumulative effect to keep you heart healthy throughout life.
Well, thank you so much to both of you. Again, the website is Time to Talk Cardio, and thank you for your input and great information. Have a great day.
Thank you.
You too. Thanks very much.
Of course, you can always find the latest information to keep you and your family healthy right here on SheKnows.com. Just visit our health channel. Thanks for joining me today. I'm Shea Pasa. I'll see you next time.
You've been watching She Knows TV. For more She Knows Daily Dish, go to SheKnows.com. Be sure to follow She Knows and Shea on Facebook and Twitter.